each month from 1 to 2, and we're doing this to build and share an understanding of common and uncommon knowledge of the practice of nutrition in the care of our patients and ourselves. There are no rules. The rules are, just don't hoard the knowledge. If you're enjoying what you're receiving, be a participant and share some of your own knowledge. Let me know you'd like to present and share something. And let other people know that this opportunity is out there, which is easier to do when the web page works. So what does this mean? I would love for anybody to put together a topic for about 30-35 minutes with some notes or things like that. And if you want to do teleconference, we can do that. If you want to do webinar, just let me know. We can do that, where you can share your information on a topic that maybe you have particular interest or want to share with others. So today we're gonna look into a topic from the Therapeutic Food Manual after we watch the second part of the video from last month. And so the Therapeutic Food Manual, of course, is our manual of trophotherapy, and we've done this before. And the idea behind the Therapeutic Food Manual is it sort of has a little disclaimer at the beginning that suggests that this book was by no means complete, but it was obviously compiled by some of the best and brightest. And it's really up to the doctor to make those decisions. So while the Therapeutic Food Manual may make several recommendations, it's doing that with the hopes that you're using that information and marrying it with your knowledge and selecting those supplements that are going to be the most beneficial for your patient. And as always, I like to kind of recognize those people that mentored me, particularly Dr. Dobbins, who just recently passed, and like to put a little bit of energy out there on his behalf to let everybody know how important he was to me as well. So today we're going to talk about angina, but first let's go over to our YouTube video. For those of you that are joining us on the phone, I imagine this will still relate just fine. This is a television show out of Australia called Catalyst, and this is part 2 of their cardiovascular myth presentation. So let's move on to the topic of angina. Um, so basically, what we're what we're dealing with this lifestyle, what they were kind of wrapping up on that video was the importance of exercise and how heart disease is really a lifestyle disease, and it's driven by things particularly like lack of exercise, smoking, stress, poor nutrition and diet, sleep habits, and our toxic environment. But I think the thing is that the tide is shifting, and we need to be ready for our patients when they're ready to start making those better decisions, when their paradigm starts to shift more towards what we're educated in delivering. So if we go to the therapeutic food manual and we look up the topic of angina, I think a place to start here is under this differential diagnosis heading. According to Dr. McMasters at Mount Sinai Hospital, he talked about angina as not merely being chest pain, but needing to have three or more of the following signs to determine if the pain in the chest is truly angina. And that's a pain that's behind the sternum rather than just a vague pain in the chest. It's also a pain that flares up during exertion and never at rest. So this is the person that's exercising or that's getting up and shoveling the driveway or doing something that's typically outside of their normal activity level, and that's when the pain starts. The pain will often shoot into the arm, particularly the left arm, and it's very oppressive. It's a substantial pain that stops their activity. It's not merely an ache. And of course, his fifth parameter is that pain is relieved by taking nitroglycerin, which we know is a very potent vasodilator. So if we start, of course, the general recommendation for most things in the therapeutic food manual is Catalin, and obviously that's there as sort of our base multivitamin, our whole food multivitamin that's going to cover all those known and unknown factors. But when we move into the specifics of angina, we're looking at primarily two things: Cardio Plus and Cataplex AC. Now, at the time that the therapeutic food manual was created, Cataplex ACP had not been produced yet. It had not been created as a product. And I think it's important that we, sort of remember that Cardio Plus is our multiple. It contains not only Cataplex G, but also the concentrated form of E2, along with some vitamin C, and of course the protomorphogen component. So the thing that we're looking at is can we create relaxation in the vasculature system? So we're trying to create a vasodilation in a similar fashion that nitroglycerin might, only we're doing it obviously from a nutritional perspective as opposed to a drugging perspective. So um, one other thing that's noted here is that 4 tablets of each of the above, that's the CardioPlus and AC or ACP, will usually stop the pain within an hour in absence of an infarct. So if the patient isn't actually having a heart attack, 4 of each of those should stop the pain within an hour. However, if the patient has really thick blood and their clotting time is slow, now we don't do clotting time the same as they did back when this was written. So they're talking about clotting times of 2 minutes. I think the INR and the pro times are a little different nowadays. But anyway, I think it's because most of us aren't doing clotting times in our offices. I think it's fair to say that if the patient isn't responding to Cardio Plus and Cataplex AC, but their symptoms are fitting that differential diagnosis as given by Dr. McMasters, that's when we want to look at phosphid. So this is where things are a little bit contradictory because when I think of vitamin G, I'm thinking of somebody that I'm trying to relax. I'm trying to get the system as a whole to become more relaxed and therefore more vasodilated. Whereas phosphorus or phosphfood tends to be very stimulatory. It tends to stimulate the sympathetic nervous system. But one of the things that phosphfood does, it's a very effective thinner of the blood and helps to slow that clotting time. And that may be the one factor that's going to help oxygenate the cardiac tissue so that that cramping of the heart muscle abates, which is what angina is. It's a heart muscle cramp. Now, if we look at the synergistic products, of course, the first one was phosphid. We just talked about that. And the other is organic minerals. And organic minerals is back on that other side of the homeostatic mechanism, the parasympathetic side. So when we're looking at the parasympathetic side, this is the relaxing, the vasodilating component. Sometimes we need that potassium, which is really to drive that parasympathetic function. So organic minerals, even though phosphate and organic minerals have sort of opposing effects from an autonomic standpoint, they're both working to improve circulation and therefore oxygenation of the tissues. So when you look at the synergistic products E2 and G, uh, these are what's in Cardio Plus. So he makes a little note where Cardio Plus is recommended above as inadequate. The higher concentration in the separate formulas may be required. This can occur in possibly up to 5 to 10% of cases. So coordinated suggestions is obviously autonomic imbalance. So you may look at for instance, your symptom survey and look at the sympathetic parasympathetic balance components and how that person is staging. Are they more parasympathetic, more sympathetic in their presentation? So if we go to the product bulletins and kind of peruse Cataplex G, we see that its primary effects are going to be as a coronary relaxant. So we're going to be vasodilating those blood vessels, not only peripherally, but also in the coronary circulation as well. So the main thing is we're working to vasodilate. We'll also normalize liver function, so we're going to improve some hepatic circulation as well, which is going to take some pressure off the system. So, and one of the things that we're always looking at the B vitamins and G, Cataplex G obviously is part of the B vitamin complex, is that myoneural junction, or how we're communicating from the nervous system to the skeletal system. So that muscle nerve complex. So when we start to lose or degenerate that communication between the muscle, the myo, and the nerve, the myoneural junction, the B vitamins can help us improve that. So sometimes we sort of look at the B vitamins as this idea of, who do I need to call? Do I need to call the plumber, or do I need to call the electrician? And when I think of Cataplex G, I tend to think more of a plumber. I'm opening up the pipes. When I think of Cataplex B, I'm thinking about improving that function at the myoneural junction. Though both B and G will work on that, as well as the importance of that potassium for maintaining that resting potential of the action potential. So when you see here, unless the degeneration has gone too far, the administration of Cataplex G with its cholinesterase precursors and organic minerals that are potassium source often quickly restores the functional response. So what it's saying is it's resetting that myoneural junction and resetting that resting potential. The failure of that synapse may be suspected in local areas of stress in various conditions, particularly angina, coronary insufficiency, stomach spasms, or other complaints of nervousness. So again, product bulletin, we look at Cardio Plus. We're looking at a product that contains obviously Cataplex G and Cataplex E2. And the synergists that are going to work with Cardio Plus are going to be things like organic minerals. Again, the organic minerals or the potassium to start to reset that action potential or that resting potential of the nerve before it fires that action potential. So I think it's fair to say, without calcium, we can't maintain that normal physiologic balance at the action potential. So if we look at calcium lactate and we marry that with organic minerals, we start to look a whole lot like Mintran. So in a situation like angina, where I know the patient could probably use a little bit of calcium to help relax the system further. They may also be complaining of maybe a little insomnia or difficulty relaxing. I can do two birds with one stone, kind of doing that calcium lactate organic minerals by just giving them Mintran. Of course, all of these patients, we need to also make sure we're looking upstream at digestion and particularly blood sugar issues, and that's why beta food is always a really common uh, adjunct to any cardiovascular protocols, because we need to make sure we're normalizing blood sugar. So in general, we can use Cardio Plus whenever we find muscular problems, as it acts as a potentiator of the nutrition to that muscle cell. And I'm sure most of you are aware, but maybe you aren't, that there is another product called Myo Plus, which is exactly the same product as Cardio Plus, which you can use for the patient who may be a little bit suggestible or concerned that they have a heart problem, and you don't want to communicate this as being as necessarily a heart problem, but a muscular problem. So you can use Myo Plus instead. Cataplex ACP, I chose to talk about ACP instead of AC, though they're very similar products, and if I was out of stock of one, I would simply give the other. But the idea here is that most of these cardiovascular patients that are, you don't see kids with angina. You see adults with angina because they've achieved a certain amount of degenerative function and atherosclerosis. And one of the reasons that is because they're losing connective tissue integrity. And the place that we want to address that most aggressively is with vitamin C, and with the components that we kind of gather with vitamin C, particularly rutin. That's the P factor, which is found so predominantly in things like buckwheat. So not to overanalyze it, but if again, there's a lot of products that Standard Process uses that that really focuses on that whole food component of vitamin C. So Cyruta Plus would be one that's very similar, as well as Cyruta. These are all going to be excellent products that help repair and promote epithelial and connective tissue integrity. It's also worth mentioning that vitamin C is very vital in the oxygen carrying capacity of hemoglobin. Another reason why it's so vital in angina is because obviously angina is a muscle cramp, typically as we see it as a loss of blood supply or oxygen delivery to those cardiac muscles. So by opening up the vasculature, by opening up those pipes with Cataplex G and having a more efficient oxygen delivery system, Cataplex C or vitamin C, we start to treat that problem upstream where it lives, instead of just simply medically by opening up the pipes. Now, Cataplex E2 is our fraction of the E component that is really about treating angina. It's about oxygenating the tissue. So I use E2 by itself in a couple of situations. I do use it occasionally with angina when Cardio Plus is not enough or not working as well as I'd like. And I also use it for people that are traveling into higher elevation areas. So when I have, so in Montana here, I have a handful of patients that live the cold months at sea level, and then the warmer months at the elevation here, which is about 6,000 feet. And oftentimes they have a little bit of difficulty acclimatizing to the elevation, and this is a great product to help getting the body carrying more oxygen and getting more efficient at living at elevation. Interestingly, one of the things, just kind of reading through the product bulletin, was this idea of the nervous stomach, or the painful stomach in the absence of true ulcer, where Cataplex E2 can be really beneficial for that as well. Cataplex F was mentioned as kind of one of the synergistic products, and reason being is because it's a great calcium diffuser. It improves that calcium delivery, which helps relax that what I would say the system as a whole, but it kind of helps balance that autonomic nervous system, where we have a little bit better balance between the sympathetic and parasympathetic nervous system sides. So we already talked about phosphid, but it bears repeating that primarily with regards to angina, we're using this as a blood thinner. And one of the ways that it's doing that is it's combating the calcium buildup, particularly in the epithelia of the vasculature of the blood vessels. So by lowering that viscosity of the blood, we've got better flow through those arteries and therefore better nutrient and oxygen delivery. So it's also suggested that phosphid prevents that excessive hydrostatic or water pressure, fluid pressure in the blood, and potentially also in the cerebrospinal fluid. So this is where you may consider phosphid not only for angina, but for maybe the patient that's having the pressure headache, uh, particularly those that may have, for some reason, have had a spinal tap and they're still having a lot of pain in their heads. So maybe in a handful of cases in the last decade, I've had 5 or 6 patients that have had kind of that post-spinal tap persistent headache. And sometimes they suggest that the puncture to the cord is never quite healed, and they're losing pressure in that cerebrospinal fluid system. So some cranial balancing and things like phosphid could be utilized in situations like that. So this is just a kind of a blip from the vitamin news where it suggests the use of VP phosphate should be used for the first month or two of treatment, as it does 2 important things by lowering the blood viscosity and thereby by improving circulation. So it's important to remember that Standard Process used to be called the Vitamin Products Company, so VP stands for Vitamin Products, and Phosfood used to be called Phosphate. And again, when I'm looking for patients that suggest need for something like organic minerals, I'm looking for people that are having sensitivity to light, or a tightness or a lump in their throat, uh, sort of a difficulty swallowing, which is the kind of feeling that you or I might get when we get bad news of the passing of someone close to us, and we get that choked up feeling. That's if a person is getting that on a frequent basis, that's a great sign that they need more potassium, and organically bound minerals is the place to address that from. Uh, Also, just noticing a fast or pounding heartbeat that fails to calm. So the person who's going to bed at night and they really feel their heart or they hear it in their ears would be another great patient to investigate organically bound minerals. So just kind of a reminder of this idea of who am I calling? Am I calling the plumber, or am I calling the electrician? So today we're mostly calling the plumber. We're talking about Cardio Plus or Cataplex G. So this is the nutrient deficiency where we see the coronary vasculature is blocked, and we're trying to open that block. So we need to work on vasodilation and getting rid of the thickness or sludge in the pipe, which may require the use of something like phosphid. So some other considerations, uh, particularly important one is Circuplex. I particularly don't like taking phosphid. It's fairly distasteful to me, but Circuplex contains some phosphid as well as some RNA and some other blood thinning agents. So I typically use Circuplex in situations where I don't think patients are going to be terribly compliant with taking a liquid phosphid product. Of course, we have a new product called Cellular Vitality that's going to be a great cardiac product. It does have some coenzyme Q10, and of course, we didn't address any of the anti-inflammatory effects that could come with something like a simple omega-3 like tuna omega. Well, we sort of briefly covered Minchex and Mintran, the idea of we're getting the benefit of not only the organic minerals but calcium at the same time, and making sure that we're addressing uh, things like the digestive system with Zypan. Or is there a lot of stress on the portal circulation and some things like Livoplex? Of course, the things that we started off with, making sure that the patient is getting some exercise, drinking appropriately, getting good sleep, staying away from high-risk habits, and doing something where they're following, like in the video, they suggested a Mediterranean diet. I typically utilize the PAGE Phase 2 diet with my patients. They're all based on that same idea of reducing processed foods and highly carbohydrate dense foods. So I think it's worthwhile to mention a few things from Medier because I think they're fantastic and they provide some things that are above and beyond what we can give sometimes with just our standard process products. So from a simple protocol for angina herbally, we'd be looking at hawthorn tablets and Vitanox. Vitanox being really good at improving circulation, particularly the microcirculation. And it's going to be really excellent at supporting connective tissue and blood vessels, capillaries. I'd like to spend a second talking about Gotu-Kola complex because I've been using it a little bit more and more. Uh, Gotu-Kola I sort of think of as my herbal equivalent to Ligaplex. So this is going to be an excellent soft tissue support. So one of the strategies that I might employ with a patient is for that first month where I'm treating angina or treating a situation where I want to work on their connective tissue integrity, I may do Cataplex AC or ACP for a bottle or for a month, which is oftentimes what the bottle kind of equates to. And then I may switch them to Gotu-Kola for a month. And then I may switch them to Cyruta Plus for a month. So I'm going through kind of stepwise a sequence of different avenues of approaching how I can improve or fortify the integrity of those connective tissues. And Gotu-Kola is one of my new go-to connective tissue supporters. For the person who's very stressed out and kind of high tension, valerian can be very helpful. It's also important to remember that angina is really a heart cramp. And so something like Cramplex can be wildly effective. So if you're running into a situation where you've tried the Cardio Plus, and then you've gone so far as to maybe go into the G and the E2 separately, and you're still having that difficulty, something like Cramplex may be the next logical step. Again, if the person's a little bit more of that phosphorus type situation where we're trying to get some blood thinning going on, whereas I would use Circuplex, garlic would be another great stepwise product. So you may use Circuplex for a month and then go ahead and do garlic for a month. And for those that are kind of obese that were working on their blood sugar and trying to augment weight loss, that's when I look at products like Coleus Forte. So it's important that I like this quote, the awareness that health is dependent upon habits that we control makes us the first generation in history that to a large extent determines its own destiny. So let's control our destiny. Let's make some good decisions. Let's help our patients make those decisions, particularly with regards to simple lifestyle things that they know better with regards to like stopping smoking is vitally important. So I'd like to thank everybody for joining us today. I apologize for web page difficulties. Hopefully our web page will be a backup maybe this afternoon. We've contacted our guru. So if there's any questions, you can throw it in the chat window. Otherwise, I thank everybody for joining us.